Good morning.
Welcome to the morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
Good morning, Dr. Andy Tan.
Very good morning.
Good morning, Dr. Tan. Dr. Tan is an OBGYN. Why do you say OBGYN and not the proper term?
Because it's easier than saying obstetrics and gynecology. I think the Americans call it OBGYN,
Yes.
right? Yeah.
And yeah,
Here we
correct.
just say gynae.
And in short form, some people say OB-GYN. Yeah.
OB-GYN,
yes.
okay. But there's a
I like that.
difference.
Yeah.
There's a difference between obstetrics and gynecology.
Yes, exactly. So, but in Singapore, majority of us still practice obstetrics and gynecologists. But in certain countries, they subspecialize. Then they do majority of the obstetrics. Some do most of it in gynecology.
Gynecology,
Yeah.
okay.
So, Doctor, although today Angel is going to lead the way,
Yeah.
I just want to ask you, what's the difference between what is obstetrics and what is gynecology?
Yeah. So obstetrics, what it means actually is more dealing with the babies. So for example, delivering babies, during antenatal cares and all that. So for gynecology wise, you're dealing more with women's health. For example, abnormal bleeding, not related to the pregnancy, and remainings of a non-obstetrics part. So gynecology just means that. So there's two categories here.
And you specialize in both.
I would say yes. We still practice both obstetric and gynecology, but I also do more of a gynecology to be. Yeah, to be
Okay,
exact.
okay. Okay, so today we are unmasking women's hidden health threats, or when women experience pain that may not be normal. Today we're talking about the truth about fibroids. And I think the first thing before we jump into any questions is for you to tell us what exactly a fibroid is.
Yeah, exactly. So when we talk about gynecological conditions and we want to know what is the commonest condition, right? So there's always benign conditions, which is not cancerous, and then something is cancer. So fibroid is actually a very common condition. I think one of the most common gynecological conditions. So what does that mean? Actually, fibroids, many people doesn't know it. It's actually a growth, all right? It's a non-cancerous growth, and majority of it grow in the womb, all right? It can, it's actually defined as like kind of a smooth muscle growth and a fibrous growth. All right, it can be very muscular. All right, so and it's growing in the womb. It can be from the size of tiny peanuts and can grow up to like a melon size.
Wow. Oh my gosh, a melon size.
That's correct.
And always inside the womb? Does it ever grow
Majority,
outside?
yes, majority are in the womb. So
Okay.
it can be, of course, categorized into what part of the womb. You have an inner side of the womb, which is called the endometrium, on the muscle layer of the womb, or at the surface layer of the womb, we call it the serosa. But majority are in the womb, yeah.
But won't a person feel extremely uncomfortable? I mean, before it reaches that size?
Yes, exactly. So, to be frank, majority, the good thing is that fibroids, they are not cancerous. So and majority of them don't have symptoms. All right. So until, like you said, when it grows such big size, 10 centimeter, is causing all the symptoms of pressure symptoms, like causing a back pain, bloating symptoms, or even pressing on the bladder. Then they start to say, hey, how come I run toilet so frequently now? So then when they seek doctors, then they say, oh, actually you have a fibroids.
Oh, okay. 10
Now my back
centimeters
is aching
huge.
now.
Yeah, I do see.
I'm psychosomatic, by the way.
Oh my god.
I do have seen a fibroid that grow up to 20 centimeter as well. So it can grow really very big.
Wow. Okay.
Does it affect men?
I know.
Okay. The pain is gone.
So you shouldn't feel anything exactly.
All right, let's continue to talk to Dr. Tan on the Big Show TV. Meantime, here's Zico featuring Jenny. This is Spot on Kiss 92.
Everything okay, my man?
So when you say they only realize they have something wrong when they start to push down on the bladder or they have back pain and stuff like that, does it feel like a pregnancy at all?
Okay, when it grows until the size of a pregnancy, yes, they do.
So it can give those kind of symptoms.
So when it
Correct.
reaches the size of a melon, that's you feel the symptoms of pregnancy.
Yes. So exactly. So and for fibroids, it doesn't mean it's only one of fibroid it will grow. It can be multiple fibroids. In my experience, I removed like up to 50 fibroids before for one person. So it can range from all the sizes, from
Small,
peanuts,
right,
correct,
okay.
small up to the melon size. So,
So why exactly does a fibroid grow? And does everyone get it?
yeah. So the thing is, how common is this? Very common. So there's always risk factors. Not everyone will have it, but age is one of the risk factors. So if anyone at the age of 40 if you go for a health screening check or you go for a gynecologist check, just want to know, is there any problem? About 40% would have fibroid, and you do not know about it. And once you reach 50, maybe up to 70%, 50 to 70% on ultrasound, you have incidental finding of fibroids. So because it can be asymptomatic, we say that it's so small that you don't have any symptoms at all. So that's how it's common. All right. Second thing is the race. All right. We know that African descendants have higher risk of having a fibroids.
Okay.
And if you have family history, if let's say your mom has history of fibroids, then you need to remove the womb due to heavy bleeding and all that. Yes, then you are at risk. You are higher risk of having a fibroid.
Right. So do fibroids, do all fibroids grow? So if someone has like little fibroids, like you mentioned, the size of a peanut and all that, when should they get it removed?
Yeah.
Yeah.
Okay, good questions. So majority, they don't have symptoms, and we know that it's not cancerous. However, they do grow. So especially in your reproductive age group. So as long as you're not menopausal, it depends on the estrogen components in your body and the progesterone. So it will continue to grow, but usually grow in a slow pace. All right. It doesn't, most of the time, probably 1 centimeter in a year's time, in a year. So if you have many fibroids, each of them will grow. Right,
Okay.
increasing in size. So when do you need surgery? Most of the time, when the symptoms. All right, we'll talk about it. It's just like you say. So when do you need surgery? So most of the time is when it's big, causing you pressure symptoms, pain, or other thing is like bleeding problems. Because if the fibroids grow in the endometrial lining, despite being 1 centimeter, it can cause heavy bleeding and causes anemia.
Oh, wow.
So those you will require surgery.
So we have someone on our Facebook, Jen, who is asking whether fibroids are the same as polyps.
Okay, so fibroids is different from polyp, all right? Fibroid, as I mentioned earlier, is defined as a smooth muscle and it's fibrous, all right? Polyp is more of a, we say, like a flash. Polyp happens in the mucosal layer, so it usually happens in the endometrial lining, all right? So this fibroids can happen anywhere in the womb.
And men can get polyps, but men don't get fibroids.
Yes, the polyps usually happen in the mucosa, like for example, the colon, you can find polyps, or the gastric,
Okay. And how are fibroids removed? Is
Okay.
this a big surgery?
Yeah, so it depends on the size, where is origin, where exactly. So usually there are 3 different modalities. So one is what we say hysteroscopy. So what does hysteroscopy mean? So many know about colonoscopy, means a scope through the colon, large bowel. But hystero means the womb. So you do a scope into the womb, all right, and then removal of the endometrial polyp or the fibroid.
Where you go from
Yes,
the underneath.
underneath.
Okay,
yes.
not through the belly button or
Not
anything.
through the belly button.
Okay.
So because the growth that's in the endometrium, so you need to go through the approach that is nearest to the fibroid.
Okay, got
Okay,
it.
so that's
Okay.
one way. Second, if let's say you grow in the muscle, all right, you can't reach through the hysteroscopy, then yes, you can be done through laparoscopy or even robotic assisted laparoscopy. So to remove as many fibroids as you can see. So however, of course, depends on the size. If you have like melon size 20 centimeter, sometimes it may not be safe, all right, it may not be good enough to remove the fibroids, then yes, you still go back to conventional way. So it's doing a big cut on the tummy, removing the fibroid.
Like a C-section?
Yes, sometimes it will be C-section, all right, sometimes it will be midline surgery, like those general surgery that remove the
Like
fibroid.
almost like back in the day, how they. Oh,
Yes,
wow.
exactly.
Okay.
So it depends on the size, the where they're located near the fibroids.
Okay.
Now, what can women do to avoid fibroids developing in them?
Yeah. So, as mentioned earlier, there's risk factors. Some risk factors you can't modify, right? Family history. However, of course, is there any modifiable risk factors? So we know that this fibroids growth depends on the estrogen and progesterone. So some diets do have more contents of this. For example, red meat. Okay, if excessive alcohol intake, all this potential causes the fibroid to grow.
So you're saying an increase in estrogen causes
Yes,
the fibroids.
exactly.
That's why menopausal women won't be as much at risk.
So,
Okay.
yeah. So that would be the risk factor. You can avoid that. Stay healthy, lifestyle, not being overweight. So these are the components that can cause the fibroid to grow.
Always goes back to that healthy
Alcohol.
lifestyle.
No, every week.
Alcohol.
It's like
We have Mel.
moderation.
We have
Yeah.
Mel on our Facebook. We have about a minute and a half left. asking whether fibroids will become cancerous over time.
Yeah, majority of the fibroids, they're not cancers. However, there's always a small risk. So that's in the literature will say that anyone that's less than 50 years old, the risk of fibroids become cancerous is 1 in 1,000 risk. So it's very, very low.
Okay.
However, once you're above 50, the risk slightly increase, probably range from 1 in 500. So,
but then those over 50 don't have so much of a risk of getting fibroids in the first place,
yes,
right?
exactly.
Okay.
Yeah. So, but you do have fibroids. Generally, we'll advise say, okay, you probably need to monitor it, see whether it grows. If it suddenly grows after menopause, yes, that's potential risk of
Okay.
cancer.
We'll go for a traffic update and go back on air.
Kiss 92 traffic.
On the TPE towards the PIE, a vehicle's broken down at Tampines Avenue 10's entrance. Look out for that. Also on the PIE towards Changi before Thompson Road, an accident causing backup all the way to Lawney Road. Avoid lane 1. Other than that, it looks like it's just heavy and slow traffic because of those wet roads. Please let us know if you spot anything. 8855
Welcome back to Good Morning Doctor, and this morning we welcome to the Big Show studio from Gleneagles Hospital, Dr. Andy Tan, who is an OBGYN.
Oh, yeah, is it
Yeah.
OBGYN?
Yeah,
OBGYN.
It's an
I see
Indonesian
it, I see it
yeah.
on his scrubs.
Yeah.
Is that used in Singapore a lot?
Not many. So
Not
we
many.
usually say ONG, specialist. So that's more of it. Yeah.
Okay.
I like that. OBGYN.
OBGYN.
OBGYN. Now, I don't know whether you asked this question early on, Angel, because, I don't listen when you talk.
That's true.
Just kidding. Just kidding. But, doctor, what is normal for period menstrual pain, and when do women know that the pain that they're experiencing isn't normal or typical?
Yeah. So talking about period pain, it's also one of the commonest condition, right? In the lifetime they will experience pain. So majority of the women shouldn't feel much of a pain, all right? But you can feel some cramps and all that during period, but shouldn't last more than 3 days generally. However, if your pain starts to get worsen every time, this period, okay, like this, second time, third time, you get worse and worse, yes, that's probably something underlying, there's some problem. When we say that something pain is normal, is that when we say there's no underlying pathology, means you don't find anything. Sometimes you have gone for a check, you say, hey, nothing wrong with you. You just the period pain. Yes, it's true. What we call this is primary dysmenorrhea. It is the condition where that you experience is due to the changes in the womb. All right, because of the bleeding, the ischemic changes, the chemicals that inside you are just slightly more sensitive that you have experienced pain. But most of the condition like this will improve after childbirth.
So a pain during your period that kind of disallows you to continue living life normally is not usual, right?
Yes, exactly.
Okay, yeah, because we heard this from the previous gynecologist as well, and that was eye-opening to us because growing up in school, we know of lots of girls that have severe pains, kind of crutched over, can't go to school, can't do anything, and that's not normal.
Right.
Yeah. So if someone experienced that pain until that they can't go to work, they can't do anything, yes, that's something, right? So you need
Wow.
to take
Yeah.
attention.
But then Dr. Tan also said, after childbirth, it all gets better.
That is for primary dysmenorrhea. So if you have the pain until like that scenario, like
Yeah.
you
That's
can't go
extreme.
to extreme, then yes, you need to find out what is the underlying pathology. The commonest condition is may or may related to the topic we'll talk about today. But endometriosis is top of the list. You usually will say, hey, you have so much pain and all that. Yes, then you need to rule out that.
Okay.
I see. Okay. Let's continue to talk to Dr. Tan on the Big Show TV. It is 8:20.
Kiss 92 Time Check brought to you by Putian.
So speaking of childbirth and all that, do fibroids affect pregnancies or childbirth?
Okay, certain fibroids, yes, it depends on the location. So if the fibroids that are located in the endometrial lining, yes, it can affect pregnancy. So for example, implantation. What we want to know is that the pregnancy have to implant in the endometrium, which is the inner lining of the womb. So if you do have fibroids that distort the anatomy of the endometrial lining, yes, it can cause miscarriage and then, failure to get pregnant and all that.
Okay.
So another way is that when the fibroid is too big.
Yeah.
All right. That's always you can try to get pregnant first. Well, if you fail, right? For example, some fibroids grow more than 5 centimeters. Yes, there's some consensus say yes. If the fibroid is too big, you still no results after trying for a while. Then yes, those fibroids may require to be removed.
Wow.
Can you remove fibroids while you're pregnant?
Generally, we try not to remove
Okay,
fibroids.
okay.
Yeah, when you're pregnant. But if you don't get pregnant because of all this condition, yes,
Then you remove them. Okay.
yeah.
We have Winston that says a friend of mine has severe fibroids. Can it be managed with natural medicines and things like fasting? What about avoiding the wrong kind of food?
Okay, you can try, of course, avoid all the food that I mentioned earlier that can triggers, more estrogen components that stimulates the growth.
Red meat.
Less,
Avoid
Yes.
less tofu?
alcohol.
Yes,
as well.
Soy
yes,
products,
exactly. So, yes, but to a certain extent, but not everyone works for everyone, right? So if you already have fibroids, to avoid this, the fibroid is still there. So if let's say there's symptoms arise, for example, causing anemia, then no choice. You have to remove the fibroid. Certain medications can help to reduce these problems, but if it's very severe, you may require to have undergo surgery. Yeah.
Okay, we have another question from Jen. Any downtime after a hysterectomy or do's or don'ts of advised after?
Yeah, it depends on what approach for the hysterectomy. Generally, that's what we'd say approach will be either open surgery, which is a big cut tummy, or a keyhole surgery. So definitely keyhole surgery, you will have less pain, faster recovery. So general, I would say if you have hysterectomy, which is the womb removal, all right, the recovery and the whole process of the recovery probably range from 6 weeks up to 12 weeks. Depends on our approach. But if it's laparoscopy, generally about 6 weeks, usually will achieve a full recovery.
Okay, okay. And is there a particular age group of women that get fibroids? Does it happen in teens or younger girls?
Yeah, I would say that it can happen in younger age group, but commonly we find it's when they reach above 30. So 30 to 40, probably about 30-40% when you come to do a screening check, ultrasound, yes, incidental finding of fibroids happen. So once you reach 50 years old, 50 to 70% of women do have fibroids. Yeah.
Okay.
So would you say, like, if a woman is constantly feeling tired, feeling weak, she should go for a check probably, especially if she is maybe 50 and above?
Yeah, I would say that. Yeah, so it can be many components, right? It can be many other factors and all that. So generally, if someone feels tired, it can be due to anemia, right?
Yeah.
Because of low hemoglobin or red blood cells, can be other components. Of course, yes. After you've checked a health screening, what are the components? If it's anemia, then yes, then you rule out other causes. Is it bleeding? Where is the bleeding from?
Not enough iron and stuff like
exactly.
that, right?
So then you rule out others. Then if some people, some women mention, yes, I do have a heavy bleeding. Yes, then you will require to see a gynecologist.
Okay.
Yeah.
I know it's recommended for women to take a lot of iron, especially when they're still on their periods. But postmenopausal, is that still as important for women's health?
I would say if you have a balanced diet, you probably don't need that. Yeah, because you are not experiencing every month period anymore.
The loss of blood.
Yeah, loss of that. Yeah.
Okay. We have a question from YouTube. Doctor, you mentioned pain will reduce after childbirth, pain of fibroids. Why is that?
Okay, I wouldn't say that the pain will reduce after childbirth due to fibroids. What I meant earlier, if it's the pain due to period pain is due to primary dysmenorrhea, there's no underlying cause, that will reduce.
Okay.
Yeah. So if the pain generally, I think from fibroids that causes pain is due to either the size itself or because it grows so much. All right, the blood supply is not enough to sustain the growth, then yes, it causes ischemia, the pain. Another type is that it's so big that it's twisting itself that causes pain. Another one is inside the endometrial lining, it's trying to extrude itself that causes the pain. This type of pain, yes, you require the removal. If it's not, the pain will be persistent.
Right.
Okay.
But whatever it is, giving birth has health benefits.
Yeah.
Hey, the
more
government should use that as a tagline.
Yes, yes. Have more kids.
Yeah.
Have more kids
I love that.
and lessen the pain. Hey, but then that's not always the case either. Okay, no wonder they cannot use that tagline.
What about uterine fibroids? Is that the same thing?
Yes.
It's the
Uterine
same thing.
fibroids, or some country will call it myoma. So the scientific name for fibroids is leiomyoma.
Okay.
All right. Many countries will use myoma as a short form of the fibroids, but we commonly call it as fibroids.
Just fibroids.
Yeah.
Okay. All right. Okay.
Okay. I don't
What
know.
about
What else
the-
should I ask the doctor? I'm thinking.
Okay.
I'm thinking like a woman today.
Okay. I've got a woman question.
Okay.
All right. What should we avoid if you have fibroids? Okay, I know you mentioned alcohol and stuff like that, but what about things like supplements? What about things like exercise? I mean, should that stop or increase?
Yeah, I would say maintain a healthy lifestyle. Like I say, do exercise, manage your weight if you're overweight, because all this adipose tissue, the fat tissues, can convert to estrogen and stimulate growth as well. So in terms of the diet, supplements, I don't think there's anything that will triggers and all that, but of course in moderation shouldn't be an issue. Yeah.
Okay.
All right.
Kiss 92 traffic.
We have an obstacle that's been spotted on the ECP heading into the city. This is before Shears Avenue. If you're on that stretch, please get out of lane 4. Also on the CTE towards the AYE, a broken down vehicle at the Outram Road entrance. Spot anything else out there? Let us know. 8855 0920.
Welcome back to The Big Show and The Big Show TV. We are speaking to Dr. Andy Tan from Gleneagles Hospital. He is an OBGYN, which is an obstetrics and gynecology doctor, OBGYN. Right?
OBGYN,
Okay,
that's right.
Wait. Before I lose my train of thought,
Sure.
because I said today I'm thinking like a woman, right? So I'm going to ask the doctor this. Okay, as a woman, doctor, why do we have so many problems?
I always
Why
get
is this so unfair?
Yes, I always get the questions from patients. Oh, is the next life I want to be a man?
Yeah.
Yeah.
Their
so
life
less
is so
problem.
simple.
Yeah, life is it's what it is. But yeah, of course that you will have problems. That seek advice and all that. Not every problem is a problem. So just to find out what exactly is the underlying problems.
So many problems there already.
Ladies, just lead a happy, healthy, active lifestyle, and that's the best you can do, right?
Yeah.
Okay, so Annie is asking, I think maybe the final question. I had a removal of my uterus, but I kept my ovaries. How regularly should I still get a pap smear or ultrasound done?
Okay, I would say if you have removed the womb, all right, what we call hysterectomy, generally in Singapore, we do remove the cervix as well. So in terms of removing a womb, right, it's usually encompass cervix as well. So this is called a total hysterectomy. In that case, if you have the pathology from the reports doesn't show any problem from the cervix, generally you don't need any more pap smear.
Oh, okay.
Yeah,
All right,
because
okay.
the cervix has been removed,
Yeah.
right? So you don't need any pap smear. However, if of course that there's some changes or abnormalities in the cervix, then yes, you will be required to do pap smear. Depends on what the findings. Coming to the ultrasound, all right. Generally, it's not, I would say, a good screening for ovarian cancer, because you still have the ovaries, you worry about ovarian cancer,
Yeah.
right? So, however, there's no good screening to like pap smear, all right? Of course, you can do 6 monthly, a yearly ultrasound to rule out any mass, any ovarian cysts. That would be good. However, it won't like kind of reduce your risk. Say, okay, you have done this last year, all right? Your risk of ovarian cancer is reduced by 100%. So this is something we still look into it, but it's always good that you can do a check and all that. Yeah.
I guess that's a conversation for another day.
Yeah. Right.
Well, we've got 30 seconds left. Last
Yeah.
question. So for people who are planning to go and get their fibroids removed, let's say, what is the recovery process like?
Okay, so and again depends on the what mode of surgery, all right? If it's a laparoscopy or a hysteroscopy. So hysteroscopy, I would say that's hardly any downtime, so, right? So it's a day procedure, doing a hysteroscopy and remove the fibroids. The next day you can go back to work and all that. So the recovery probably less than a week and all that. So if it's laparoscopy surgery, it depends on how many fibroids are removed and all that. So generally, it's laparoscopy is associated with lesser pain and a faster recovery. So generally, I would say full recovery after 4 weeks, you'll be back to work. You'll be able to go back to work. All right. If you are going for a major surgery, laparotomy, we would say open surgery, that will take slightly longer, probably 6 to 12 weeks.
Okay. All
Okay.
right.
Well, thank you very much, Dr. Tan, for joining us today.
Thank you.
Half an hour has just flown by like that.
Yes, absolutely.
Thank
And
you.
Thank you.
We appreciate your time. All right.
For more insights or to replay today's segment, the full episode is now available on
The Big Show with Glenn and Angel on Kiss 92.
Good morning and welcome back to The Big Show and The Big Show TV. The man is in the studio. Finally, we have, I don't know whether you still like being referred to as the Demon Chef, but Chef Alvin Leung is with us. Good morning, Chef.
Hi. You can call me whatever you want. Okay? and Glenn, and Angel.
Yes.
And I assume you're Glenn. Lucky guess. But, no, it's a pleasure to be here at Kiss 92. And it's a pleasure to be in Singapore again. Because
Welcome.
I flew in yesterday, so if I show a little lack of energy, it's because of the drinking last night. And the partying in Singapore.
Oh my
You
God,
sound
look at
like
that.
Glenn's sort of person.
Oh my God, we'll be going to party together.
I was informed that I look like him. I mean, what a compliment!
I look like you.
I'm feeling my nose. I think it's gone longer. No, it hasn't. Okay.
Well, Chef Alvin Leung, aka the Demon Chef, in the studio right now. Let's just speak about the Demon Chef because it's not what everyone thinks. I mean, that's not where you got the word demon from, right? Can you explain that?
Well, I can do that in a very, very complex way. I can do it in a very non-complex way. So I'll just try to explain it in my way.
Yeah.
I'm Demon. They were calling me the Angel Chef. Okay, and I don't, or God Chef, in Chinese they always say, Chu San, God Chef, and I didn't like that because first of all, I am a Christian. Okay, am I allowed to say that?
Of
Yes,
course.
of course.
Oh, thank you. And it's actually blasphemy if you call yourself the God Chef. Because, it's one of the commandments, I don't know which one, but it's one of the, and also, I think, once you're God, you're not having any fun, okay? So demon stands for, or originate from the Greek word daemon, okay, which means somebody, a playful spirit. So instead of being the demon and
Devil and
devil
whatnot.
or you're gonna try to stick me with knives to get rid of me or but I'm just a playful spirit. That's
Okay, all
I
right.
like
okay.
that.
I
Okay,
love
I
that.
want to be like that as well.
You
Okay,
wanna be the
so
demon
from now-
DJ?
yes, the Demon DJ and the Demon Chef.
All right, fantastic.
And I got some gasoline and matches. We can start. we can start with a fiery start. But anyway,
Don't start in the studio. That's all we need. All right. You have been a judge on Masterchef Canada for 7 years. You have a restaurant in Hong Kong. It's received 2 Michelin stars in 2009, and the Macau edition upgraded to 3 stars. And by 2012 was ranked 52nd place in the list of world's best restaurants. You are now here in Singapore to be involved and sort of consult at the newest private members club that is opening up here along Orchard Road. It's a $30 million private members club, and you have been brought in to Singapore to sort of consult on what the dining experience should be like. Tell us a little bit more about Vanta.
well, first of all, I want to really kind of consult. That's a bit to understate it. Okay. I think I'm actually involved in a lot more than just telling them serve meatball in the evening or whatever. I am in Vanta. Okay, which literally, do you know what Vanta means? It's not the cousin of Fanta, but
No.
Vanta means that it's darkest of the dark.
Darkest of the
So it means
dark,
that
okay.
we're trying to absorb light, and you notice that I'm usually dressed in black, but today, unfortunately, the viewers can't see it. Okay, so I am dressed in white. So what basically we're trying to absorb light. So we're trying to get us members, people that would enjoy the experience. I'm not saying, you have to be, coming from the light to join, but basically we want people who wants to, they're in the light. I'm not saying they want to see the light because that's also very religious as well. Okay. But we want people who likes to be in the light. So basically, I'm not just a consultant. I am, I'm creating the whole concept. I'm involved in the architecture.
Oh, beautiful.
And, of course, we want to play on, it's in the heritage site,
Yes.
McDonald House.
Yeah.
Okay. Not Ronald McDonald, but the other McDonald.
I drove past it yesterday.
The other
Yeah.
McDonald. Okay. So, it's always, difficult to be a consultant chef in a place called McDonald's. Okay. But we're taking on the real heritage because it's a heritage site. So part of the experience you're going to get is on the upper level. There's 2 levels. We are creating what we call what happened in 1949, where I don't know, it's karma, or what do you call it, coma, or excuse my English, it's not great.
Karma.
But, karma, that's right, karma. That's why I'm here, because of karma. We look alike, right? You're my missing brother, okay? But anyway, we're trying to the funny thing is, that if you go to, and since I'm sure you went back and check my history because my Angel, so much.
Just a little bit.
But I never trained. But I am a fully qualified air conditioning, or what we call a ventilation, or what we call engineer, or what we call it. And McDonald House, incidentally, is the first building in Singapore with air conditioning.
Oh, wow.
Okay, hold that thought,
Interesting.
Chef. Hold that
Hang
thought.
on.
We're going to continue to talk to Chef Alvin Leung on the Big Show TV. Meantime, here's the Black Eyed Peas with I'm a Bee on Kiss 92.
No,
No. But we are on. We're on still the Big Show TV, which is on YouTube and Facebook. Don't sneak anything in. All right, so we are speaking to Chef Alvin Leung. Now, as mentioned, it is at McDonald House. It's a very, very historic building. In fact, I drove past it yesterday. I knew that you guys were going to be at McDonald House. I just didn't know where. So the spot that they've taken over is the old Citibank.
Oh,
That
okay.
had been there for decades. McCann Erickson also was on top, the rooftop. How many floors will Vanta have? Are you guys taking up the whole?
Oh, no, we're not taking up the whole
No,
building.
okay.
But eventually, when we get popular, we will be doing
So
that.
how many floors do you guys have?
We are on the ground floor.
Okay.
And on what we call probably a mezzanine floor. So
Got it.
we are on 2 levels.
Okay, 2 floors of McDonald House. And when can we expect this to be ready?
That is a
Big question, is it?
$64,000 question. With inflation, probably $640,000. But we're expecting some December. It'll be a nice Christmas present.
That's
Okay.
quite soon, yeah. Nice.
So you're going to be in town very often then?
Yeah,
Chef?
definitely. And I love to
I
be
take you
here.
up.
I love to be here.
So when it comes to the dining experience, what can members at Vanta expect?
Well, they can expect an experience that is unique. So I always tell people, with me, the Demon Chef, you're going to get something that you've never had before. Okay, so I'm trying to create something that is a unique, very exclusive experience. Obviously, being a bank, it would be fine. I don't always want to say luxury because nowadays, luxury can mean a lot of things.
It's relative, right?
Okay, it's all relative. But, I think, to me, luxury is able to do whatever you want, whenever you want. And this is something that's going to be like, I'm going to be changing the menus quite often because I think, I like that. It allows me to release my creative juices, and also, the thing about the dining downstairs. Now I explained upstairs. It's 1949, and you're basically going back in time and trying to experience what was the building like. We're banks, okay, and if you want to borrow any money, I can arrange that.
Oh, we've got some images
Oh,
of
beautiful.
creative images.
What it's going to be? It's going to be like this.
Beautiful.
Yeah, they can see this on radio.
Because we're on YouTube and Facebook as well.
Yeah, right.
So
I forgot
they
that.
can see your shirt as well. I love this Michelin man on your
Yes.
shirt. And we're going
Okay,
back
we're going going back on air now.
We're going on air, okay?
Right. Everything goes out.
Okay.
Everything.
Okay.
Okay, stand by.
What did I just say? Uck.
The Black Eyed Peas with I'm a Bee right here on Kiss 92. All the great songs in one place. Angel is starting to perspire.
Oh my gosh, I'm sweating already. We're sitting here with Chef Alvin Leung, aka the Demon Chef. He is in town for Singapore's newest $30 million private members club opening in December. Hopefully, Vanta. It's going to be located at the historic McDonald House. In fact, the location of the old Citibank. Everyone who grew up in Singapore will remember that. Chef Alvin Leung, if we can ask you what your thoughts are on Singapore's fine dining scene.
Well,
Be nice.
Be nice.
Oh, by the way, it's $30 million because they paid me 29, but but no. Look. Singapore has got a great scene. Okay, fine or not fine. And whatever you refer to as fine, okay? Because right now, like molecular gastronomy, contemporary, and all these other, farm to table and all these other figure, it has no real defined definition. So fine dining, it can either mean that, it's going to be, first thing in your mind is probably expensive, okay?
Yeah.
Okay, I mean, so obviously, it's an experience of which that, you will have, you are paying for. We're not serving you things in paper cups and you're not eating in a hole in the wall. The luxury is the whole design of the bottom floor, which has a very elaborate light system and monitor and what you call the LED screen system. So you're gonna get a visual experience. So that's why every time I change the menu, and when I say change the menu, not seasonal, okay? Because really it's only 2 seasons in Singapore. If not, okay. So I'm going to give you every time I'm going to come here often, okay? So I got to be, I got to find a wife or something like that. Any volunteer?
You know what? Both of you are looking for partners, so you guys can go out and look together.
Yeah, let's go whatever and kill 2 birds with 1 stone.
Let's go.
But no, the thing is, I'm going to be, changing the theme. And I'm not saying I'm not going to change the whole complete menu, okay? But hopefully there's some dishes there that you must go and have, all right? And then I'm going to be changing the theme according to what we have there, the lights. So you're going to get a very unique visual experience where my food is, in line or, married married to that.
And that's your expertise as well, like the design, the acoustics,
engineering
the
and all
lighting,
that,
right?
I'm a man of all trades, okay? Do you need to fix that carpet? I see a spot there.
Good. I hope the bosses are listening right now. That's what I've been telling them for the longest time. It's like, hey, I'm getting stuck here. Yeah, but no, we gotta be renovating this studio. No, the studio is too small, so we'll get chef to help us with that.
Start with a match, okay? But
We might need your help.
But you know what? We're going to have to let the chef go. But before you go, just tell us, one more time. Vanta, the food, the drinks. I mean, it's so important right now. I mean, what's the bar going to be like?
The bar is going to be, of course, it's going to be, look, we have, one of the features is 2 giant bars, okay, on each side. So we're going to be doing, we're trying to, of course, we got to please everybody nowadays. So, of course, being, the new generation, there's going to be a lot of cocktails, of which I'll be involved in, I'm involved in creating these cocktails, okay? So there'll be cocktails that matches the season or my visit, okay, and there'll be a lot of fine wines because I know in Singapore everyone loves the fine wine. I love it, but I can't afford it. It's going to be whiskey, and also we will be offering, non-alcoholic offerings, like
Of course.
I was going to ask, yeah,
of
because
course.
mocktails are so big now. I mean, and then zero alcohol
Yeah.
is really on the
We
rise.
got to
as
be
well.
all inclusive.
Yep,
Yeah.
for sure.
So we will be, according, we are in line with what's happening.
Yeah.
And that's why, they asked me to come.
Right.
They're not paying me $29 million.
No.
There you
Not
go.
yet, yeah.
They will be. But
Vegetarian options for the vegetarians.
there's
I'm vegetarian,
Of
so-
course,
okay,
the
great.
vegetarian options.
Okay.
We're trying to find something from the refuse.
Oh my God. I knew there was something coming.
No. I can
Straight
tell
from the
you.
horse's mouth.
You can be, pescatarian, vegetarian.
Yeah.
You can be everything. We will. It's my duty to make your experience unique and fun and happy. So we'll go vegetarian together.
Oh, amazing.
Okay. Thank you very much, Chef Alvin Leung, for popping by today and telling us a little bit more about Vanta. Please, if you're in town, give us a call. Keep on updating us on this wonderful private members club.
Oh, thank you very much for having me, and of course, whenever in time, I'll come. I had a
Absolutely.
fun 20 minutes.
Hey, thanks for coming in.
Thanks, Chef.